since we have a quorum, I'm starting the recording. So far, 4 of us are here: Catherine Hilton, Arlene Reed, Noreen Pease, and Garrett Simonson, and we're expecting Wim. And we've been, might as well kind of finish this up. We have been talking about our status with the immunization information system from the state, and they want us to update our information so that we'll still be active in their system. But of course, we haven't done any immunizations for quite a long time.
And also it was, what we were deficient in was regularly logging in to the system.
Oh, that's interesting.
And so I think part of the message was no one from your provider number has logged in ages, and they were going to terminate us if we didn't start checking. So since that happened, I've made a habit of logging in once a week, but there's nothing, I just log in and log out again, but I think that they needed some updated information about contacts as well. So those two things.
Okay, well, let's just wait and see what happens. I mean, if we can sort of stay in the system just in case, it's probably a good thing. But if it's a nuisance to do that.
Yeah, it's not a nuisance. I'm looking at your email that you forwarded to me, and it's Town of Shutesbury, and then they give our PIN or account number is registered with MIIS. However, there are no active access administrators registered under this site. Each registered site is required to have at least one active access administrator on file, AAs. The responsibility for facilitating registration and user account management. And in order to maintain with them, they want the name, email, and phone number of the individual, one or more, who should be listed as AAs at this site. So I can keep it going in case we ever are faced with the need to, in fact, order vaccine or yeah, I don't know what else, but
right. I mean, obviously we thought at one point that with the pandemic we would need to acquire a vaccine, but then they made the vaccine so impossible to use for local public health that of course didn't happen.
I mean, there's no harm in maintaining, and so I can let them know my contact information as an AA and try to keep it current.
Oh.
Okay.
Okay. All right. So let's not wait any longer for Wim.
Wim is here.
He is? Is that Wim?
Yep.
Oh, there he is. Hi, Wim.
You're muted, Wim. Oh,
hello.
Hello.
I couldn't, it wouldn't let me in.
Yeah, that was me. I didn't see it at first. It gave me a kind of a weird signal. I'm going to rename you. What would you like to be called?
Holly.
You've always wanted to be called Holly, right? That way, if anybody wants to look at this meeting, they'll know who is here.
Right.
So the minutes from last meeting, is everybody satisfied with them?
Yes.
Yes.
Okay. Anybody not satisfied with them? Okay, well, let's just accept them. Big deal is the septic for 032. Okay, if you would like to see it, I can show you the plan, but I think you probably know what's the story. It's a mounted system. It's up toward the road on the Nancy Dillman side.
On the which side?
The Nancy Dillman side, which is the uphill side, which would be
East.
the east side.
Okay.
And there's going to be a meeting tomorrow at 1:00 with the architects, and they have asked the Board of Health and some other committees just to check in and share information and stuff. So I'll go to that if anybody wants to go to it. It's I think it's on the website, and if it isn't, I'll get it to you. One of the things about this plan that I don't know anything about, and I'm interested in it just for my own edification, is there's the septic tank and the D-box and the leaching area way out near the road. But there is also, and this is apparently not in our purview, there's also a tight tank right up by the building that they say is required, and that is connected to the utility sink. So, or will be connected to the future utility sink. I don't know what that's about. Does anybody? So I'm going to ask just what that's about and where it shows up in the code, and do we have that at the elementary school? I know that we have a regular tank and we have a grease trap, but that's because they have a kitchen,
Right.
which we won't have at the library.
So,
So
does Claudia say anything about it? I mean, has it been reviewed by Claudia yet?
it has been reviewed by Claudia. We're ready to go with it. We're ready for a vote. And she did not mention it. And at another meeting with the architects that I attended, they said that it wasn't, because it wasn't part of the septic system, right? It's another part of the wastewater system that it wasn't something that we had to approve. So it's all a bit of a mystery, and I'll find out more tomorrow.
And isn't it DEP who usually approves tight tanks? Not, I mean, because they are, when they are a part of, when they are the means of wastewater disposal for a property, then it's a last recourse, right? That's the way
Right.
I think of it. I've never heard about a tight tank and a septic tank leach field system coexisting.
I haven't either.
Oh, yeah.
And I don't understand what the purpose of it is, or where this requirement is.
But
Now,
when we have had tight tank applications, it goes to DEP, right?
not anymore.
Oh, not anymore.
Not for a long time.
Ugh, I'm out of the loop. Okay.
Yeah. We used to have to pass it on to them, and they had to give their approval, but we don't do that anymore. They passed it on to us actually
Right.
quite some time ago.
All right.
Kat, I have a really basic question. So the architectural firm is dealing with this? Is there an engineer involved?
Oh, yes,
civil
of
engineer?
course. Of
Yeah.
course. They have a whole team, the engineers and the architects and the various
Okay.
designers, and they all work for the same, or with the
Company.
company.
Okay.
I'm not exactly sure, but yeah, we have a stamped engineered design,
Okay.
and
Thank you.
they're quite familiar with it. They've done this kind of work before for public buildings in Massachusetts. They knew which were the appropriate forms to use and what they had to do and so on. Now, the well is not in our purview. The well, because it's a public water supply, has to be approved by DEP. So we don't have anything to do with that, really.
I guess I can't think of a reason why utilities sink
Right.
have to be separate from the septic.
Me neither.
Hmm.
You know, it's not like they wanna, sorry?
I can't imagine it's a capacity thing for the septic.
No, that wouldn't make any sense. I don't know. I'll find out more tomorrow. And if anybody wants to log on, they're welcome.
I would, but I have a conflicting appointment. Sorry.
And I have a meeting at 1.
I'll find out what I can learn and report back to you. So do you want to look at the design or do you want to simply vote on it? I mean, it looks like, the usual.
Yeah, if Claudia is reviewing it, I would not be able to contribute anything by
Right,
looking
me either.
at the
I just
technical.
looked at it because it seems like I should, but what do I
Yeah.
know?
Sure.
Anybody need to see it or wish to see it?
And
Well-
so she recommended that we recommending approval. Claudia has.
Yes, she's written us a memo on that.
Mhm.
And of course, there's no fees because municipal projects are exempt. So we have the design, we have the review. Can we have a motion to approve the permit and issue it?
I move to vote on permitting this system on the basis of our health agent's review and recommendation.
Second.
Okay. Or is there any more discussion? Hearing none, all in favor, Arlene,
Yes.
Noreen,
Yes.
Wim? What was that?
Yes.
Garrett?
Yes.
Cat, yes. Okay, so unanimously, we have voted to issue the permit for the library septic system. Okay, so another thing on the agenda, of course, is 56 Wendell Road. I did reach out to various other town officials, and I didn't really get I didn't really get any guidance at all. Lenny didn't answer me. Kristen said, sure, I'll meet. Becky said that the person on the select board most interested in this would be Rita. So I contacted Rita, and she's away until the 14th. And she said she needs to make sure that the rest of the select board is comfortable with her representing them in a meeting. So we have a sort of hypothetical meeting that we're thinking about for after the 14th. Now, I also included Claudia in this correspondence, and Claudia pretty much disagreed with our opinion that we don't have a serious threat to the public health here. And her arguments were pretty good. I'll find them and read them to you if you want. What she would like us to do tonight is vote to order a reinspection of the property by Claudia. And then we'll have sort of laid the groundwork for future action.
A reinspection by, I'm sorry, by whom?
By Claudia.
By herself. Okay.
Yeah, so that she would go back and verify that they have not met our requirements. And she will also be able to get a sense of how secure the property is, how infested it might be with whatever might have moved in there and so on. She'll be able to look at the various aspects of our order and the sort of health status of the place, the public health status of the place. And then I guess she will report back to us and we will make some kind of a decision about what to do next. And we've already talked about then having a meeting of various town entities and the homeowners to come up with a good solution.
When was Claudia last there?
Probably when the condemnation was done, and that was what, 3 years ago?
And I have a
Go ahead.
I have a question. If we order Claudia to go in, are the owners then required to set up a time to allow her to go in? How does that work?
That's a good question. I think they are. And I don't imagine that would be a problem, but I'm not really sure.
I'm just anticipating, should it become a problem, what recourse do we have, or how does that work?
Considering that the place has been condemned, I think that, and that it's not inhabited, I think that gives us more power, right? It's because it's not like we're going into somebody's residence. But that's a good question. I'll ask Claudia more about it.
Okay.
But I expect that it won't be a problem. I can't imagine that the Steves would refuse. One thing that's been concerning me is I've driven by it a few times and seen one of the doors open. There's a door further to the north. There's the main door, and then further to the north, there's another door, and I've sometimes seen that door open. Now, I don't know if it's open because Greg is on the other side of it, or if it's open because the place isn't being kept secure. I told Greg it had, after seeing that, I told him that it had to be secured. Claudia said that there were parts of the house that could not be secured. So that's another thing that we need to. However, that didn't turn up in the condemnation order, so I'm a little puzzled about that.
Well, is the address 56 Wendell Road?
Yes.
I'll make a motion that we formulate an order for Claudia to go in and re-inspect 56 Wendell Road.
I think that we don't actually have to write an order. We just have to tell her that we voted to do so. And I told her I would do that tonight after we voted.
Okay, well, so the motion is that we just advise
Claudia to do it.
Okay.
She doesn't want to do it without our specific vote.
Okay, then I move that we authorize Claudia Lucas to go into 56 Wendell Road and be inspected and report back to the board.
Second.
Okay, any further discussion? Okay, hearing none, let's vote. Arlene?
Yes.
Noreen?
Yes.
Wim?
Yes.
Garrett?
Yes.
Kat, yes. Okay, so that's unanimous. I will get in touch with Claudia tonight and tell her that we voted unanimously to have her re-inspect the place. And she will write a regular formal letter, notice of inspection, and send it, I'm probably certified mail or in some way, to the owners. And then we'll see. Okay, was there anything else on the agenda? I don't have it in front of me.
Can I just make a statement about the collaborative is meeting tomorrow? I'm unable to go, and Garrett said he's able to attend in the morning. So just one thing that Carolyn Ness and I discussed after the MAFCO meeting, Garrett, was perhaps asking Athena to put on the agenda a discussion by our collaborative as to, how we feel EDSs should be set up for the eastern part of the county. And perhaps this board might want to discuss that too at some point, since, you know, both us and Leverett are, well, ourselves, Leverett, Deerfield, Greenfield, we're all separate EDSs. So we should probably have some discussion as to whether we want to remain that way or whether it makes some sense to try and collaborate more closely as EDSs as well.
But that would involve making decisions up front about how and where to collaborate, right? If we decided we wanted to collaborate with, say, Leverett and Deerfield and.
Yeah, I think at least you and Arlene were on the meeting the other day. I think it came up with regard to how we would formulate our EDS plans.
Mhm.
And my understanding is they were talking about having a template for an EDS plan that would fit most, if not all EDSs, but then you could also have individual differences, you know, within those, depending on how the county decided to move forward in terms of the number of EDSs that makes sense. And so I think we haven't revisited this subject the whole time I've been involved in MAFCO or on this board, I think. So I think it makes some sense to at least have some discussion about it and think about what makes sense now and into the future.
Okay. I'm trying to imagine what that kind of discussion would look like. There, I guess the questions that we would have are, do we want to have an EDS here? Do we want to share it with anybody else? Do we want to just throw in our lot, say with Deerfield, and use their large facilities and considerable experience? And then, of course, the next question after that is, you know, do the other communities that we're interested in collaborating with want to work with us?
Right. Well, I think that's why the collaborative is a good place to perhaps begin to have some of those discussions as well, to see what they're thinking. And I think a lot of the thinking is anyway with the pandemic and even now with flu clinics and that sort of thing, populations, I know our population thinks about going to Amherst or Hampshire County also, but you know, most communities are going to Greenfield, Deerfield, you know, Shelburne, that sort of thing. And are we capable? Do we have the capability in all instances to set up a responsive EDS? I think we need to think about that. And maybe, I don't know, Garrett, maybe you've had some discussions of this sort with your groups too, or I don't know if you have any.
Well, I guess that I think that the conversation about, you know, even like even Leverett having their own EDS is really about the circumstance, you know, the situation that might lead to that, you know. So maybe if it were, you know, a food handler within the school, or you know, and it leads to an outbreak, that's a sort of situation where we might set up a Shutesbury or Leverett specific clinic to take care of a very defined population that's specific to the town. But you know, whether it's H1N1, COVID, you know, just the way that vaccines are managed in today's day and age, it's highly unlikely that we as Shutesbury would do our own EDS.
Right.
Especially since we don't have the vaccine storage capacity.
You know, so if it was a one-off situation and, you know, the state or FERCog or whoever were able to deploy in, you know, vaccine for a very specific situation, very specific to our population, I could see us doing it, but less likely in a bigger event, I think.
Right, you know, they were talking at the meeting about people wouldn't go far for a treatment or a vaccine. But it seems to me that, I mean, since we've quit doing flu vaccines, all of our people have, and you know, and with COVID, of course, have done perfectly well going down into Amherst, which is where most people go, to get this. I don't see access really being a big problem for us. And I have to say, I was astonished when they started talking about having your, you know, MOUs and MOAs with your venue. We've never had any kind of formal agreement with the school. Not ever. Anyway,
This conversation is making me feel more clear about maintaining our MIIS registration.
okay,
Should we, especially if we collaborate with someone and we each need to submit data pertinent to our community, even if we're not purchasing the vaccine.
mhm,
So I will name, I will step up and say, provide my contact information as an access administrator. They allow you to name more than one. As chair of the board, are you okay being a secondary?
I guess so, but I have no idea how it works, and you know what
Well-
I have to do. I'd have to be trained on it.
Right, you and me both. But
Okay.
rather than lose our PIN and our, you know, I guess they call that number a PIN.
Mm.
I'll provide contact information so we continue to be registered, should we need.
Okay,
Okay,
okay. Maybe it might be good to also check in with Sarah and see if she knows anything.
okay.
She might be able to give us advice.
She's still, Tuesdays, she's still in town hall, is that right?
As far as I know, Tuesdays from 12:30 to 4.
Okay,
Oh, and we got a little report. Megan sent us a report.
Oh, good.
On what Sarah has done. I should have sent it around to you, and I will, but it was.
I think we all got it. I
Oh,
received
did
it.
everybody get it?
Yeah. I did,
so it was from Megan.
yes.
I think it just came to Noreen and to me.
Okay, because
Yeah,
we're on
And
the,
I
It
forwarded
came,
it.
it came to
Yeah.
me somehow, but I don't know if somebody.
Yeah, I forwarded it to you.
Okay, okay. I'll forward it on to Arlene and Wim.
Thanks.
so can I just finish my request to Garrett? So if you would just mention, Garrett, that perhaps you know, some time be made at some point on the collaborative agenda to begin to talk a little bit about how we might want to organize EDSs too. And, you know, maybe all the towns should start having this kind of discussion. We can think about how we should be organized.
And you said that Carolyn was on board with that idea.
She is, yes, yeah.
Arlene, I have access to MIIS at work. If you want to put me down as well. I mean,
Oh, good.
I rarely go into it, but,
Right.
But you know how.
well, it's sort of, somehow it's always logged in there, so it's pretty much open access.
Oh,
Okay, I might text you for just to make sure I have your preferred email and phone number correct, okay?
Sure.
All right, good.
I think that makes sense to have two clinicians that are familiar with it would be helpful.
yeah.
Okay,
Any more on this whole topic?
No,
I would like to just update you a little bit on the district. The district, which is not a district. We had a meeting in January, and I learned that amazingly enough, our assessment for the district is actually going to go down a little bit because because Claudia's health insurance is going to be covered by Irving as they're treated because she's officially a town employee there. So our assessment is expected to go down a bit, which is nice. It might go down further because Ashfield is interested in joining the district.
Oh,
When I was concerned that it would be more, more workload than Claudia can handle, but she said she's already working for Ashfield sort of independently. So she's already doing the work. And this would just be a different way of organizing it. So it was thought that perhaps it might juggle the way the assessments, the formula for the assessments. At the moment, Shutesbury pays 43% of the budget, the whole district budget, except for that health insurance piece, which is broken out. And so our share might be a little less. On the other hand, the budget's going to have to be a little more if Ashfield's part is going to be added in. So I can't imagine that it will go down very much if it goes down at all.
well,
So-
my comment is I have a lot of nicknames, one of which is Ashfield, so I'm way in favor of Ashfield.
Okay, well, yeah, we're all in favor of their joining if they want to. And in fact, we encouraged them to get it together so that they could actually go to their town meeting this spring and vote themselves in.
I think they have a new board chair, so I wouldn't be surprised if there wasn't a little more moving and shaking going on up
That'd be
there.
good.
So, yeah.
That'd be very good. So one of the things we talked about was renaming the district, since Eastern Franklin County Health District is just wrong in so many different ways. It's not a district, strictly speaking. It's not limited to Eastern Franklin County. There is no Eastern Franklin County as far as that goes, since we don't have counties anymore, or county governments. So I wasn't sure, and we're all supposed to be thinking about this for next time. I wasn't exactly sure what even the main noun would be. And I also wasn't sure how much any name would conflict with the names of all these other groups that we have.
Mm.
So I don't know if you guys can help with that a little bit. What we now call the district is, let's just define it. It is an association of communities that share the services of a health agent.
Hmm.
So, we talked about the obvious things, collaborative and coalition and I don't know what all else. Association.
And this would be,
I mean, if there was no, go ahead.
no, I was just gonna ask is, so whatever the name ends up being, it would be used in external communication with other districts or statewide agencies?
Well, that's a good question. Mainly, I mean, I'm not sure how much communication we have outside just our own communities. It's basically a matter of letterhead.
Right. All right.
And kind of another question too, during the pandemic, we got funding as a district. Does that mean because we're not a district that we wouldn't be eligible for that in the future? Remember we got funding for our tents and so forth?
Yeah, I remember that. That was a sort of special purpose pandemic funding, and it went either to single communities or to larger regional entities. So instead of getting that from that particular fund, instead of getting it just for Shutesbury, we were able to get it as part of the district.
Hmm.
So I don't think changing the name of it is going to be significant in that way, because apparently we did quite a lot of research and looking back in this historical documents and enabling legislation and all that stuff, and we found out that in fact the district is not a district and never was, because the district has a particular definition, which I couldn't tell you what it is, but that we didn't meet it and we weren't required to meet it. I mean, there was a grant, and they had this sort of district nomenclature and structure, but what a health district is technically, it's not what we've ever had.
Okay.
And of course, the whole idea that it's a district, which suggests that it's geographically condensed, right? I mean, the towns are just all over the place. And with Ashfield, even more so, anyway.
For sure.
Is there a deadline for this new name?
No, it's just something we feel we should have. So if you have any great ideas, let me know. Or even any ideas. They don't have to be great. You can have crappy ideas. I'm perfectly happy to get them.
Okay. I'll give it some thought.
Okay.
It could be the Big D, but then we get sued by the Big E.
Well, then you have the lazy D, you know, down here too. So.
Uh-huh.
All right. Well, I'm ready to adjourn if anybody else is.
Is there anything else that we should be talking about tonight?
I have nothing.
Okay.
We meet again
Oh.
on the 21st, 2 weeks from tonight.
Yes.
Can I maybe I wait until after we stop recording, but can I ask a question about water testing? Because they came and took a sample yesterday.
Who are they?
The Henshaw well driller.
Oh, I see, because you put in a new well.
Yeah.
Right. So that's part of the whole shtick. They put in the well and they come back and they take a test, and then they test that water for the parameters that are in our well permit.
And the results will be sent directly to you?
Yes, they're
Okay.
supposed to be sent directly to me, and also the driller's log.
Great.
Right?
All right.
I haven't seen the driller's log yet, but I'm assuming that it will come along.
Perfect.
So how deep's the well?
260.
Hmm.
18 gallons a minute.
Wow, you got plenty of water. Like that,
Plenty.
18 gallons a minute, that's plenty.
Yeah.
Good deal.
Yeah.
Yeah, and that's not too deep. There's a lot of deeper wells than that.
Yeah, it's not
Okay.
too deep.
Yeah. Good deal.
All right.
Okay, are we done?
Yes.
Okay. Okay, everybody's ready to adjourn? Nobody has anything else to say? Okay, let us adjourn. It's 28.
Okay.
Thank you all. See you in 2
Thank
weeks.
you.
If you come up with a great name for the district, let me know.
All right.
All right.
I'm
Okay.
sure you'll get some winners, Kat.
Right, they can be as crazy as you want. I don't care.
You should make it a contest. That would motivate us. There should be a prize.
That's
Okay,
true.
okay. I'll think of what the prize is and I'll send it around.
The
How
Greater
about a cherry
Shutesbury,
pie?
Greater
Oh, yeah.
Greater Shutesbury Public Health Alliance.
There you go.
Greater Shutesbury, I love it.
Metropolitan Shutesbury. Right.
Okay, you guys, see you in a couple
All right.
of weeks. Thank
So
you.
All
long.
right. See ya.
Bye.
Bye.